Hi everybody, my name is Dr. Amy Spoelstra, and we are talking about some of the biggest challenges that chiropractors make when working with kids with neuro-deflective disorders or behavioral, learning, and socialization challenges. And not just kids, adults too. Today I want to talk about one of the biggest challenges, and I think that is not knowing how to recommend appropriate care plans. You see, when we don't know enough about how to take the complexity of brain development, of behavioral learning, socialization challenges, or deflective development, and really know what that looks like by taking an appropriate case history based on leading with brain development, do appropriate exam and outcome assessment measures so we can understand the trajectory of change that we're looking at and looking for and how to set goals for that. See, when we don't know how to do that, then we're lost with really not knowing how to set appropriate care plans. So a lot of people are too afraid to give long care plans because they're treating the symptoms, right? Because we don't know enough in this realm and know how to apply it specifically to our objective measures when looking at the nervous system and the subluxation, we tend to get nervous and set really short care plans and not deliver the appropriate amount of care that these kids and adults often need, and often they need a little more care than the average person. But if we don't know why that is, or how to objectively measure that, and how to really look at what we're seeing and not just chase the hyperactivity or the reading challenge or the behavior or the learning challenge or socialization challenge, if we don't know how to put those pieces together, then we're just sort of like flying in the dark. We don't know how to set an appropriate care plan to start. We don't know what to look at to measure progress. And so we, one, give up and get insecure about it, or two, we tend to lose the patient too soon because we are treating the symptoms, because we just kind of say at first, hey, we're not treating the symptoms, but then after a period of time, you become just another therapy or therapeutic approach that the parents have tried, and the symptoms haven't necessarily decreased in the short amount of time that you've given it or they've given it just because, not because you're doing something wrong, but potentially because you didn't know how to set appropriate goals. You didn't know how to specifically watch and monitor progress and change based on the developmental hierarchies of the brain, because you didn't know. And that's okay, but that puts us in this position where we become just another therapy, just another therapeutic approach, which we don't want to be, and we're not, that these parents have tried, and we lose them. And there goes somebody that we really could have helped. We really could have changed the trajectory of their life. And so that's a problem. The other problem with care plans is sometimes we give way too long of care plans, and we don't know why we're giving them. It's not really based on much. Maybe it's based on some of our objective measures of the nervous system, which is wonderful, but we have to be able to translate that to specific deflections in behavior and learning and these developmental hierarchies, these 8 developmental hierarchies of brain development, so that we can understand, well, maybe we're not seeing changes just yet with reading, but we are seeing changes with the ability to control self and make engagement outside of self, and this child's starting to make friends and pick up on emotions, and we have to understand what that tells us about the brain. And when we can do that, simply by taking the complexity of this and boiling it down to something that we can really apply and use in our clinical practices, it is so freeing, it is so amazing, and you get to see just incredible changes in the expression of life of these, not just the child, but the whole family. And you get to empower the parents and the caretakers and the family and the individual by helping them understand that we're not chasing the symptom, but we're starting to help them move towards more whole brain function, have a better expression of life, and we can watch multiple different areas to see that progress happening. This is incredible work. We have the potential to really make a huge change in this population, and they need us. This population of behavioral learning and socialization challenges is not going away. In fact, it's getting much, much worse, and we have the potential as a profession to really be the team leaders for these kids. And I encourage you all to understand that we don't necessarily have to do more in our practices, but we do have to know more.